Who am I waiting to hear from? We're live. Brilliant. Right. Hello, everybody. Thank you very much for coming along to this meeting of the Health and Wellbeing Board, the Dorset Health and Wellbeing Board. It is a one-item agenda, a little bit actually, so don't go away after the item, because there's something that Paul and I would like to just touch with you on the forward plan item, which is quite important. But it is a one item, quite a substantial item. Many of you will be familiar with it, others new, the Better Care Fund plan. But welcome, and welcome to the year of 2022. So the first thing I'd need to do to open the meeting is to ask for any apologies.
Just have one apology, and that's from Dr. Danny Farrell.
Yeah, thanks, Fiona. Dr. Danny Farrell, if there are any others that people know about or think about, just let Fiona or me know so that we can note those. The next item I need to do is any declarations of interest. The way that we'll operate the meeting is through the hands up facility if you have it, but we'll also try and keep an eye on the chat bar as well. And I do have to read out a statement since we are meeting virtually. Therefore, I will just read this out so that everyone can understand that if decisions are made, how it'll be taken forward in this, because we're meeting virtually, not in person. Members were advised that where a decision was required, the appropriate corporate director would be the responsible individual to make the decision. Oh, sorry, I've started the wrong place. I'll go back. In consultation with group leaders, the chief executive has exercised his delegated powers to revert to virtual informal meetings of council committees reflecting the emergence of Omicron and the rise in COVID cases locally, in order to protect elected members, staff and the public, and of course our partners on the Health and Wellbeing Board, to be able to carry out the business of the council and the Health and Wellbeing Board partner responsibilities. Members were advised that where a decision was required, the appropriate corporate director would be the responsible individual to make the decision, whilst considering the views expressed by the wider committee membership. The report on today's agenda requires a decision by the board, and the relevant director to make the formal decision, follow a minded to decision by the board, will be the executive director for people and adults. So I will then move on to the next item, which is public participation. And I understand we have no public participation notified to the board in the time allocated. So I move on to item number 4, which is questions from members. And I understand there are no questions from members that have been submitted in the time required for preparation for those questions. So the next item on the agenda today is the Better Care Fund Plan 2021 to 2022, and I'd like to welcome Leslie, who is here, but actually Sarah Sewell. Lovely to see you, Sarah, and I understand you will be presenting the paper today, but also assisted by Kate Calvert from the CCG. So do you want to carry on, please, both of you?
Yeah, we'll do. I'll just bear with me. I'll just share my screen. So
thanks,
bear
Sarah.
With me. Okay.
Just so we're clear, would you prefer questions at the end?
Yes, please, if we could.
Okay.
Is that okay? I'm happy to take them as we go. You just need to shout out because I can't see you. You can't see hands, can you, when you present?
No. If I see something really urgent going on in the chat bar, then I'll let you know. But I'm sure members will understand that actually their questions might be answered as we progress through the presentation.
Great. Okay. Shall I go?
You go.
Lovely, thank you. So good afternoon, everybody. So for those of you that don't know me, I'm Sarah Still, one of the strategic commissioning leads in the Adult Social Care commissioning team at Dorset Council. Kate, did you want to take the opportunity to introduce yourself?
Yes, good afternoon, everybody. I'm Kate Calvert, and I'm the Deputy Director for Primary and Community Care at Dorset CCG. And within my portfolio sits the Better Care Fund, hence why I'm here today supporting Sarah.
Thanks, Kate. So the recommendations that we've brought to you today are outlined in the report. Just to explain, we've also provided the other attachments, which are the Better Care Fund plan, which is the Excel document, and then the narrative plan, which was the additional information that we submitted to NHSE. So the recommendations that we've described in the report are to ask that the Health and Wellbeing Board approves the Better Care Fund plan for this financial year. That in future we will provide you update reports on our progress at your March meeting and at your November meeting later this year, and also to agree delegated approval for subsequent plans if a Health and Wellbeing Board meeting can't be convened within the NHSE sign-off period. So that delegation we're proposing would be to the Executive Director for Adult Care and Housing, following consultation with the Health and Wellbeing Board's chair, and that would obviously be in consultation with CCG colleagues as is required in that sign-off. So just wanted to give you an update in terms of how we've submitted the plans and what the current position is. So as it's outlined in the report that you've got, we submitted our plans and narrative document as was required of us by NHSE on the 16th of November. Unfortunately, NHSE were delayed in publishing their planning requirements for this year, and that didn't give us time to bring that submission to you in advance. We were able to submit the plans with the provision that a Health and Wellbeing Board meeting was in the diary, and hence our meeting and the one-off item on the agenda today. In terms of assurance, our plans were approved by senior council and CCG officers. So for the council, that was the chief executive, the Section 151 officer, and our director of adult social care. And at the CCG, that was the accountable officer and the lead officer. By way of an update since submitting the papers to you, on the 22nd of December, the Better Care Fund manager for this region has confirmed that all of the South West submissions, obviously including Dorset's, meets those national conditions and the planning requirements and has been recommended for approval, albeit that is pending your sign-off today. So the final stage will be pending your sign-off approval via an NHSE executives meeting that's being held later in the month. We haven't had that date or heard the outcome of that, so we'll obviously update you as we hear information as that process continues. So just to share a few headlines with you, I'm sure you're aware of this, but just as a quick recap. So the Better Care Fund and the Improved Better Care Fund provides Dorset with a total pooled budget of just under £137 million. And within the policy framework, there are 4 national conditions that we have to meet in evidence. And those are a jointly agreed plan between the local health and social care commissioners that's signed off by this board, that the NHS contribution to adult social care is maintained in line with the uplift to the minimum contribution, the CCG minimum contribution, that we invest in NHS commissioned out of hospital services, and that we have plans in place for improving outcomes for people who are being discharged from hospital. And in addition to meeting those national conditions, we also have metrics that we report on around our reablement services, around where people are discharged to from hospital, how our avoidable admissions are, and also the numbers of adults whose long-term care needs are met by admission to a care home. So I just wanted to use this opportunity just to give you some examples of how the fund is used to support services. So in terms of improving outcomes for people being discharged from hospital, I won't read through all of these that I've listed here, but you'll be aware that the funding is broken down into themes of into schemes. We theme it into schemes. So this isn't an exhaustive list, but just some examples. And the narrative paper that we shared with you as the supporting documentation gives you more of that information, and it also evidences in that narrative paper how other funding streams such as those supporting Home First are linked together, and how that kind of joint working is going across the system. So just to point out a few examples, so within maintaining independence, some of the examples of those services are the Dorset Accessible Home Service, and that includes the statutory disabled facilities grants. We've got moving on from hospital living, and that's our pooled budget that supports an LD cohort to live in the community. Then within supported hospital discharge, we have all of our integrated health and social care teams working, and as another example is the provision of our reopenment service. We've then got through the Dorset Care Framework within that strong and sustainable care markets scheme, the placements that we make through into domiciliary care and residential placements. And then in integrated health and social care teams, that district nursing capacity is another example of the services that BCF funding supports. I have just shown on this slide the asterisks. They are the areas where the inflationary uplift was applied. So there was a 5.3% inflationary uplift this year, which amounted to just under 593,000. So those are the areas where that inflationary uplift was applied to kind of really recognise some of the pressures that we were working with at this time. So just to give you a couple of other scenarios and examples of other Dorset priorities that are supported by the BCF. So for the strong and sustainable care markets, we've got those resources to manage and review the market. So that's linked to the market oversight and provider failure work that we do, and ensuring that the services that we have there are of adequate quality and in enabling that service improvement. And then that really important key work that carers do. So funding of the carers caseworkers, carers training, and those really important respite and short breaks offers that are supported this way. So I mentioned earlier in terms of the metrics, so we propose to bring you some detailed information back to the March meeting in terms of our performance. I've just listed here in a bit more detail what those metrics are that we report against. We do expect our performance to have deteriorated when we come back to you, and that will be in the main due to COVID, where the services are running with reduced capacity because of the workforce pressures that we're experiencing. And this is just the final slide, just to give you the assurance on where we report and what our governance arrangements are. So we have the national reporting that will be recommencing in March. We're still waiting for that guidance to come through. That was halted due to COVID pressures in March 2020, so that is recommencing. We have the joint commissioning group that is across the Dorset footprint, so that's BCP Council, Dorset Council and NHS, Dorset CCG. And as we're proposing, we'll be continuing to report back to this board on the activity and financial performance. We'll bring that report back to you with the detailed performance at the March meeting, and then 6 months thereafter, so then to the November and so on. So that concludes the presentation. Are there any questions that spring to mind? If I just take my screen back down again so I can see.
I'm not seeing any hands up. Oh yes, there's a hand gone up. Trying to work out whose hand it is at the moment. Forbes' hand. Hi, Forbes.
It's me, Rebecca. Hi, sorry, I was
Hi there.
It's late. Thanks for your presentation and report, which I found very comprehensive and interesting. I just wanted to ask you about section 5.2, maintaining independence and assistive technologies. I just wondered how well developed we are in terms of our utilisation of these, in terms of maintaining independence. You know, there's more and more digital means available, aren't there, to do all sorts of things, and as we have such pressures on the system, particularly in terms of workforce to provide care, could assistive technologies be better utilised to help in that way?
Should I take this question, Les, or did you want to come in?
You can start and I'll come in after,
okay.
if that's helpful.
Yeah, I know that. Okay, I know that colleagues are looking more into the digital offer that there is. I know there are some pilots out there looking at what can be done. So it's an area for sort of further development, I would say, and we have got commissioning officers certainly that work on that area. Les, did you need to add to that?
I would just add in as well. we've just changed. We're in the middle of changing one of our contracted providers in this area. We did have a strategic partner, but we're now looking at bringing some of that retained information back in house to get more work done in that space. But Sarah's correct, as are you, Forbes, that there is still more work to do in this. We did, of course, have the one-day event, didn't we? And I can see Sam's got his hand up, which he might be referring to that, where we did everybody went through some of the tech and digital offers that were available, which went very well, actually, I think, earlier in the year, and it had quite a number of hits on it for people that saw that virtually. But I think still there is more to do.
Was that all right, Forbes?
Yeah, fine, thank you. Just you know, is another enabler for keeping people at home that we could, you know, develop more.
That's correct, yeah.
I don't know if you were listening to one of the radio programs this morning. There was a lady actually speaking about how assisted technology was helping her stay in her home just by the use of her iPad and her iPhone. It's so obvious, isn't it? But it's just there's a lot of education, isn't there, that we need, and fear and culture that we need to change. But good to hear that there's going to be progress. Sam, you've probably got something really relevant to ask and say. Hi, Sam.
Hi, good afternoon, everybody. A bit of a confession, really. When I read this report, it was like getting reacquainted with an old friend that I haven't seen for a couple of years. And it's following on from Forbes' comment, really. There were loads of areas in this paper where I felt I understand the words and I understand the jargon, but I'm not entirely sure what that now means in the context of the pressures and the current focus of where we're heading. And we're on the cusp of becoming an integrated care system. And the thought that occurred to me was just to ask people's views as to whether it would be worth us spending a bit more time getting behind the scenes of things like the Home First strategy work that's going on. And something that's been sort of vexing me at the moment is what we use our place-based partnerships for, because I reread the Thriving Places guidance, and it's quite clear in there that there's an opportunity to look at using place-based partnerships to get much more into the meat of health and social care planning and integration through that lens of place. So it's not to propose solutions, but I would find it hugely helpful if we could just get together and talk around some of the headlines in this report. There's loads in it. There's absolutely tons, including things like the better use of population health management data, which was referenced. But again, I'm not sure how widespread or embedded that is, but it would be great if we could provide a bit more of a focus on that going forwards, because this is going to be absolutely key, isn't it, if we're going to be turning around the current model, which is very focused on acute and crisis, and starting to work much more on admission avoidance.
Brilliant. Thanks, Sam. I think that there was something in the chat bar saying that more can be presented, but there's something else on that I think I'd like to come back to. But before we do, I've got Kate and then Leslie. Kate, hi.
Thanks, Rebecca. Just to respond to you, Sam, I totally agree in terms of looking forward. BCF we've always kind of continued to do the same and rolled it over. And of course, because of COVID, a lot's happened, and the BCF effectively has, become, I think, a focus on the home first, so that acute element and supported discharge. The planning always comes late, which doesn't help. So, Leslie and Sarah and Sharon and I were talking the other day about actually having more of a strategic conversation and moving into that place-based and neighbourhood level and joining up all the dots, because there's a lot of other funding opportunities coming through health. For example, the Ageing Well program, that anticipatory care model, because it's not just about supporting people being discharged from hospital, but it's about that keeping people well in the community. So lots of opportunity going forward, and it would be really nice to have a different conversation strategically.
Shall I take Leslie and then try and find out where we can take that to? Leslie?
So I was just going to, Sam, in relation to the Home First, there's a paper coming to the Scrutiny Committee later on this month. which I think, so there's a thing for me around us making sure we're all hearing the same conversation as well, having the same conversation. But there is a whole update coming to the scrutiny committee that will be presented by the system, which is also relating to sufficiency. We've got a paper coming on sufficiency of our market as well. And I think all of that combined, it all needs to be taken into account to think about what is our strategic approach going to be taken forward. So we'll share that paper directly though, Sam, so that you don't have to go searching.
Margaret.
Yeah, thank you. Just another point in relation to Home First. Healthwatch Dorset's about to start gathering feedback from carers about their experience of Home First, and that's working with Dorset Healthcare and the Volunteer Centre Dorset. So that work's going to be happening over the next couple of months as well.
Thanks, Margaret. And I think this is all building up to, there's a huge amount going on, but what I would like to just understand, and this is from a non-operational viewpoint, but what numbers are we talking about? How many people are in this system that we're either helping to not enter into the acute system, and how many are we thinking about that we're trying to actually discharge from hospital? What sort of population? And if there's no answer sort of directly today, the performance figures, where are those available, Sarah, on the system? Where can members go and see?
Yeah,
and are they broken down geographically? Are you getting into the place so we can understand where the pressures are, if it's in certain places within the geographical area, or how are we looking at this?
I'd need to confirm back to you after the meeting. I'll take that away and find out for you. I would imagine that a lot of from a location perspective, it will be mainly attached to the point of discharge. So we just need to understand how we link that through to where that person's point of discharge is in terms of the localities across the county. But we can certainly bring that back.
Okay, I'm just trying to think about what we can see in the meantime, because bringing it back is, you know, end of March, and actually we're trying to understand how the system is actually helping our residents, and then from a board point of view, from the members of the board who are here, how they can identify places they might be able to assist. So it's probably getting more of a practical understanding of what does happen in a town, in a village, so that one can align potentially others, particularly the voluntary sector, the fire service, police, into actually physically what is happening in an area. Is that at all possible? Maybe Kate's got the answer, or Leslie. Kate, you had your hand up?
Yeah, thanks, Rebecca. I think at the high level, in terms of the metrics tied to the Better Care Fund, they're at local authority levels. So I'm not sure how much we could break that down, but I'm certainly happy to take that back to our business intelligence team to see what level of detail we have that sits below that. But equally, we do, as Sam said, the theme of population health management and being able to use our DICE to start to help inform the service, delivery model. We've got an opportunity going forward. I'm just not sure we're necessarily there yet, but I will certainly take it back in terms of the current metrics and information that we have.
Thank you. Leslie?
Thank you. So we have is a number of different data sources. We've got it broken down from a local authority perspective, an area perspective. We've got it broken down by locality, which we can bring the number of referrals, the number of contacts, the number of people that we're supporting through from a local authority perspective. We can bring that down in detail. So that does give place information. Some of the metrics that are mentioned in here, 2 of them are new. So the first one on ambulatory care, which we've been grappling with, haven't we, Kate, about how we're going to collect that. That one is going to need to be worked up, and I don't think they've got the metrics that they think they're going to pull through in place, haven't you, to now to measure that. The things around reablement and around residential people into residential care, we can provide that straight away, actually, because we've got that information. I just don't have it to press the button now to give you, but I can get you at the end of this session.
Okay. Before I bring in Simon, I just wondered, therefore, following on from Sam's sort of ask about bringing us together to maybe understand more of the change that this is making to our residents. Where should we do that? Do we do that in a separate meeting? Is there a meeting that already happens so that others can join that to understand it a bit more? Maybe have a think about the best way of bringing that forward, because I wouldn't like to lose sight of it, but I'm very aware that taking up a health and wellbeing board meeting is probably not the place for that. But I'll move on to Simon and then Vivian. Simon. Hi, Simon.
Hi, sorry. Thank you, Councillor Knox, and thank you also for the reference to the volunteer sector and the voluntary sector. It's nice to see under 5.3 the voluntary community support get a mention. I just wonder if there's enough emphasis placed on this, and particularly picking up on some of the comments earlier, where it seems to be a top-down cascade of information and contacts, and I'd question whether there doesn't need to be a stronger voice for the volunteer sector, because I actually think that the people who are providing the care, getting involved, have a huge amount to add in terms of what goes very well, what doesn't go so well, and should we be adding a little bit more in there to get the feedback and bring and have an upward communication way from the voluntary sector. And I did have a second point, but I can come on to that in a minute if you wanted.
Any reflections on what Simon said? I think we're sort of going along the same line of actually getting to grips with what the difference is that is being made here, so that we can get a feel for what is required from others. Vivian, maybe you want to reflect on that.
Yeah, and absolutely. I mean, I think the conversation we're having is the conversation that we really welcome in terms of the Better Care Fund. I think you know, it has been stalled for 2 years, as we've talked about, but this is the conversation we really need to be having, actually, about, you know, what is the value of what we're actually putting in place, and what we've put in place historically, and the funding that's being used at the moment needs to be in preparation for what do we strategically as a system want to be influencing and impacting on at place. And so that, you know, this is the conversation absolutely we need to be able to have, and as we progress through this March and November times, when we come back formally with a presentation, I think in the intermediary conversations across the system, we are having conversations around, so what's the impact at place? What do we need to do pre-admission? What do we need to do to support people to remain in their own homes? So Forbes's query around making sure we are doing the right thing for people to remain at home and to support them in the community, as well as what are we doing to ensure that people are well supported at the discharge. Having that sort of wider lens at the Health and Wellbeing Board, I think it'd be really important, so that we are able to look and work at place and see the impact that we are having, and that the concentration and lens is just not on the end of discharge. But it's actually, how do we support people to remain at home, and how do we get people through the acute system when they need to be in care, and how are we supporting people better through this mechanism and other mechanisms once they are leaving hospital and living at home.
Okay, so on a sort of operational day-to-day front, if you take a town like Blandford, I always pick on Blandford, the links in a community of what is there, whether it's whatever level of social care, working with the voluntary sector, those that learning at a community level, that conversation takes place. Did I get that right from Leslie, that actually we do have locality working groups? I think it's that visibility that would be really useful to understand, and also what the definition of what the Better Care Fund folk are using as a locality. What it, and that's part of the place conversation. What is a locality? Is it focused around the GP surgery? Is it focused around a children's centre? It might change in all sorts of different circumstances depending on where it is in Dorset and who doesn't have certain. But that I'm trying to get to the sort of nub of, are we having this discussion to bring it into that place-based understanding of your community, health inequality need, health need, but also importantly that prevention need, that early prevention need. So that's this sort of assurance. I think, Vivian, you're giving me that, and I'd just like to maybe ensure that is something everyone is aware of. So, because as a board, we're bringing all sorts of different organisations together with a joint outcome, which we're coming to after, about the Health and Wellbeing Board. You know, what are we all here for? But making sure everyone can be as involved as possible in a meaningful way. So that feels potentially like a meeting. Maybe it's post-March board meeting, or maybe it's before. I'm not sure, but an informal discussion to actually get to grips with that, and maybe it would help the conversation which Sam and John Selgren and others are having on that place work within the ICS. Leslie, you've got a hand up again, and then Simon. Oh no, Patricia, sorry. Patricia was next, and I've been talking too much. So Patricia, are you there?
I am. I'm sorry, I've had to switch my camera off because the sunlight's shining in my window, and it looks like I've got a halo over the top of my head.
I'm sure you have.
I agree actually with a lot of what you've said, Rebecca, about place and the connections. I suppose the point that I always raise is when we only look at the Better Care Fund in terms of admission, avoidance and discharge, we look at things through a really narrow lens. And what would be really helpful in my mind is, particularly when we talk about discharge, is having the context of what's delivered through Better Care Fund in terms of the wider conversation about frail elderly people and safe discharge. Because if I look at the system today, we have over 400 people in beds, hospital beds, who shouldn't be there because they're medically fit to leave, and there isn't the capacity in the system to make sure that they have a safe discharge. And as the responsibility of the Health and Wellbeing Board, we know that for every day any of those individuals that are over 65 stay in that bed, then there's a much higher possibility that they're going to end up in long-term care. So I'd want us to talk about the whole context and put the Better Care Fund within that, and then you get in a broader view of the impact that it's having, which is very positive, but also that we've got a much bigger problem to solve.
Thank you, Patricia. Vivian, you did have a hand. I don't know if it's a legacy hand, but anything to say to help that conversation along?
I think it's the right conversation to be having. I mean, I think the system conversations that we are having about the here and now and the heat in the system needs to be the conversation we'll also have in this setting about, you know, we have got some very hot issues in the system at the moment as a result of scarcity of social care and workforce pressures, but it's wider than that. So it's so the sort of lens we look at the pressures in the system needs to be, as Patricia has said, it's the whole of the system we need to be looking at, rather than just that very thin lens of discharge, and how the Better Care Fund supports that, but where it can't do that because of and to be really clear about the other mechanisms that we put in place and how we report other on those mechanisms, because I think that's really important that we don't look at this in isolation, that it's seen about how does this support the system to meet its responsibilities. Because I don't know whether Tim wants to come in, but I think we've got some real significant pressures, you know, both in the acutes and in the community health and care system, that this forms part of our helpful resource that we have available to us. But it needs to be the Better Care Fund needs to be part of the solution to the longer term strategic vision that we've all got. But at the moment, it's completely focused. Our conversations are sadly completely focused on the heat in the system and the here and now. So, you know, this is absolutely the conversation we need to be having.
Okay. I'm going to take, thanks, Vivian, and we'll sort of have a wrap up of where, because I'm still not quite sure where this is where it's going to progress to, but the conversation is really helpful. It's sort of airing some things. So Leslie, you had your hand. Then I've got Tim, and I haven't forgotten Simon. But I'm just going to let Leslie and Tim in, if that's all right, Simon.
Thank you. So I wanted just to be really clear about what the expectation was for the March meeting, because as has just been articulated to Vivian and Patricia, this Better Care Fund is one part that doesn't answer all of those questions that we've just been discussing. So it is one arena, one group of services, if you like, and then there are whole chunks of other services that fit for the whole for the health and wellbeing strategy. So, and also for what the health inequalities are, it is broader than just the Better Care Fund. It's just one part of that picture. So I just needed to be clear about that in terms of what the expectation is for March, because what we will be bringing in March is a document that sets out how we've done in terms of the metrics that we've put up through the BCF and the finance that sit alongside that in terms of activity. We'll do the piece on outcomes because I think that's really important, and then try and show the links to everything else. But I don't want the board to have a higher expectation than what I think we're bringing in terms of that one piece. So I just wanted to clarify that, particularly for Sarah and Kate on the call, if that's okay. And I take your point, Simon, sorry. And I think what we'll do, Simon, if helpful, is bring some information back to the ABL Better Life shareholder group, because I think we can have some useful conversations there as well in terms of this. I think that might be a good loop for us to close there.
Okay, great. Thanks for explaining that, Leslie. And it's beginning to feel to me like maybe there's an informal session to try and have. But I'll move to Tim next. Hi, Tim.
Hi, yeah, I was just going to follow up on what Vivian said. Really, you know, we're running so hot at the moment in the system, and if we don't get this right, you know, too many people end up going into hospital, and effectively we're not getting enough out, you know, the discharge at the other end. And, you know, we can see the consequence of that now, really. You know, all 3 acute hospitals in Dorset are effectively running at 100% capacity today in terms of their, you know, their beds being totally full, which, you know, just absolutely clogs up, and you end up a very inefficient process then being run. And, you know, you see the results of it in terms of people then queuing in A&E, queuing in ambulances, waiting for ambulances. So, you know, there are a number of reasons why we've got to that point as we're at now. We're not alone in it. But part of the solution to that is through the Better Care Fund, and it is how much can we do in the community, and how much can we, you know, make that the normal place to actually provide support people, rather than what seems to be a never-ending over-reliance on our acute hospitals, which just cannot be the solution, because, you know, they are of limited size and scope and capacity and staff compared to what we could do in the community.
Thanks, Tim. And I think that absolutely is. And but the problem is always, isn't it, that you've got a really a sort of emergency situation, and that prevention work in the community always seems to come second. But actually we need to get ahead of ourselves and run in parallel, and that means more resource. But if we don't get there, we're always going to be running into the situation we're in. So it would be nice to start at the community end, and have that focus, so we can avoid some of the trips to the acutes and stay within the community. That I think is what we're trying to sort of get to, isn't it? So it'd be really good to understand what that looks like. And that might, as I said earlier, might help the place conversation. Patricia, thanks very much for your comment in the chat bar. I've seen Sam and others seen that, so that sounds like a good plan, because I know that work is ongoing with you and Paul.
Yeah.
Really good. Hello. I don't see any more. Maybe there are some hands. If I can't see any. Yeah, Simon. Sorry. Yes, Simon. Of course.
Yeah, it was only a quickie, really. I mean, I'm hearing so much and agreeing with so much that's being said, particularly Patricia around the more holistic helicopter view of this. But I'm also very conscious that there are great initiatives and good things happening here, but the devil is in the detail, and it's in the execution of these. I had the scars of a failed discharge and a failing discharge over the last 2 or 3 weeks. So I'm living with that today and yesterday and whatever. And without bringing the detail of that here, because it's inappropriate, one of the things that strikes me is, A, there's some fantastic healthcare professionals out there doing an absolutely brilliant job on an individual level, but somehow it's failing. And one of the key failures does seem to be around communication and poor communication. And so it's the little details that could just make life work so much easier and be more successful that sometimes fall down. Communications being a key one. And we must never lose sight that this isn't about number of beds and failed discharges and that. It's about a vulnerable old person being distressed, being unhappy, perhaps having a worse outcome. So there's real people at the end of this. It's not just performance metrics when we put this right. But so we mustn't lose sight of the very good things that are happening and the very good individuals. But there are some fails here, and they're happening in the detail of these things. And the more services we have and the more how things interrelate, the more the need there is for better communication, and it does fail.
Thanks, Simon. That really brings it down to earth, doesn't it? And it also sort of says, I mean, you mentioned that you've had the experience recently of a failed discharge, which that's really sad to hear about. But and what you said is it would be inappropriate to detail that, and you're quite right. But actually, sometimes some of the really good practical learning is understanding case studies, so that we can really get it into perspective. So, where is there a place where that understanding and learning from failures and as well as successes, does that go somewhere to learn between, not necessarily those of us on this board here, but for our staff? Is there a place within communities or somewhere that actually you can get together and have a look at what could have helped whether it's the voluntary sector or the fire service or police or others? Where does that happen?
I think that's such an important point, because it's how you get the community to feed back. And I guess it was what I was alluding to earlier about the upward feedback into these things. And sometimes it's the very small details that can make a tremendous difference.
So I'm maybe it's something to think about, but I'd be really interested to know in a town how would that happen with all our services. I see Forbes and then Margaret. Forbes, hello.
Thank you. I don't think I was first. I think I'm 2 or 3 down the queue, Rebecca.
Oh, I'm sorry. I've just got my numbers back. You're right. Sam, Vivian, Forbes, Margaret.
Thanks. It's just a very quick response to Simon's excellent challenge. I think if we're going to get serious about engagement and co-production, then we do have to listen to people's experiences and understand how we can learn from that when we're building in routine, proper, meaningful consultation with people about how these services are going to work better. So I think it's something that we need to build into our business as usual service improvement and transformation work going forwards. I know it happens in places at the moment. I know there's some really good examples, but we should be absolutely listening to that.
Thanks, Sam. Vivian?
Yeah, I was just going to say exactly what Sam has said, that I think there's some really good practice that it does happen, but it happens on an individual case by case basis. And we do that across the system. So the, wherever the problem has happened, then we get together in a multidisciplinary way to make sure that we pick up that learning. But Simon, I think it's a really good challenge, that how do we use that intelligence better earlier to inform our improvements and how we want to work as a system. And I think there's a real opportunity now with us coming together as an ICS and actually really trying to understand what we do at place level, that we get that more balanced and equalised position with people that use services at the same time as we are developing services, and that's a rebalancing of our relationship, I think, needs to happen with services and our residents. So absolutely fully support that, and I know that that's the work that we want to take into our place discussions. So yeah, really helpful.
That's great, Vivian. Yeah, rebalancing and looking at it in a different way. That's refreshing to hear. Forbes, you are next, then Margaret, then Patricia.
All right, thank you. Just 2 points. Some points really have been made. First of all, there's a look back. We should absolutely learn from our mistakes, and the points being made, I think, at organisational level, we do try and look at those, and certainly on an individual basis, where sometimes we fall down is where we systematise that, perhaps between health organisations, perhaps between health and local authorities, because often these people are crossing the boundaries of several organisations, and we could do that better. My other challenge, I suppose, is just how we look forward and how we better engage our communities in this sort of conversation, this sort of strategic conversation, because actually what we want to do is build a co-ownership of the challenges and therefore the solutions with them. Because actually that's a better place to be. And as a health and wellbeing board for a place, I think it's something, maybe not for today, but it'd be good for us to start thinking about in the coming months. We now have an infrastructure that can better support that, I believe, through the ICS. So we need to take it on and address it.
Brilliant. Thanks, Forbes. That really adds to the conversation. And Margaret, you're next.
Yes, I mentioned earlier that Healthwatch Dorset's about to do a specific piece of work on gathering feedback. So that should provide us with some insights into how discharge, this is particularly around discharge and how that's been going, and particularly from a carer's point of view. But that we also do hear, again, individual stories about what's happened, where there are potentially lessons to be learned. And then I also chair a patient participation group, and I also, so that through that mechanism, I also hear about people's experiences, and I'm wondering whether there might be a way through PPGs of actually gathering more information, feedback as well, so that we get that patient perspective as well through that route.
Thanks, Margaret. That's great suggestions, and it sounds like things are happening. But going back to Simon's point, we need to pull it together, or just let people know where to go. Not invent something, but let people know that is going on and can be productive. Number one on my list now is Patricia. Hi, Patricia.
Hello. Just a couple of suggestions, actually. Really support the use of some of the information from Healthwatch. I think that's really rich. A couple of the things that we do that probably could be adopted as a system approach if we wanted to, in that we quite often with the permission of patients, film them at home being interviewed by our patient liaison service to talk about good or bad experiences. One, because we use that as part of our normal review system and the board looks at them, but also we then use those videos as learning exercises for staff. But when we think about how we might systematise the review of discharge, and you can learn just as much from ones that have gone really well as you can from ones that haven't. One of the things we do across Dorset for the major trauma service is we have a regular bi-monthly meeting. Now, the numbers are not as big where we look at every single case, but it's a multi-system meeting. So the acute trust, we're there, the police are there, the air ambulance and road service are there, because we have a very comprehensive review of each case. You could adopt a similar approach for discharge, but just randomly choose ones that you want to look at and do a deeper dive with the individuals that have been involved, the family, and then use that as a learning exercise. And I've seen that work in a sort of way in terms of planning care packages for people with very complex situations in Wigan, where they pull a multi-professional group together to look at their needs. And you could adopt the same approach to reviewing discharge, because you'll get some really rich information and themes from that process that then you can take forward. And you could even decide whether you wanted to include community members in that, because you're not looking at patient level detail, you're looking at the substance of what has happened in terms of the events.
Yeah, thanks, Patricia. Those are, everyone's nodding, and really good suggestions. I might add, you could look at it the other way round as well, about why. I remember a case study that the fire service did, where we looked at a lady who didn't need to develop septicemia, but did, because there wasn't an ambulance. Not the ambulance's fault at all, but there wasn't. But there could have been someone who could have just taken her for an appointment half an hour down the road to the GP, but it turned into something chaotic. So there's a lot of learning, isn't there, from the front end of the system as well as the discharge end. And I'd have thought that there are quite a few on partners as well who might be able to facilitate that, particularly within communities. It just comes down to some of the issues about data and privacy. But, you know, some members of the public will share because they want people to learn. They want to stand up and say, I am, and this happened to me, and it's outrageous. So I think there's a lot we might be able to facilitate back in communities if that community is then heard and we learn the lessons that they get to hear about. That's probably for some of my local colleagues, my local councillor colleagues, to have a think about in terms of local democracy and places to have these conversations. So thanks, Patricia. That's really good. Claire Shields, then Mark.
Thanks, Councillor Knox. I think none of you would be surprised, given I represent Children's Services, that I might just want to have a bit of a conversation about young people and entry into adulthood, and whether or not we've thought through the Better Care Fund in the way that we would want to for those young people that are transitioning, and have we got all the schemes right for them. So I'm really thinking about the Transforming Care Partnership and the reach down across all ages for that, thinking about the All Ages Autism Review and some of the real challenges we're experiencing within the system about young people entering acute hospital admissions when we might not want them to be, and also staying there for longer. So I think there's an opportunity for us to expand this conversation, which quite often talks about older people because that's where a lot of the pressure is being felt, but there's a real challenge within the system for our younger people too. So it's a bit of an ask really that we expand the conversation when we're doing that bit of planning together.
You're absolutely right. And there is when one talks about adults, people seem to think about olders, but actually the number of young people with special needs within a local community, that cohort from 16 plus is really important and really expensive, or can be. So yeah, that of course we must, and I look to colleagues to. I think we've got Teresa here, but you've got you, Claire, so I'm sure you'll push on that one. Mark.
Thank you, Councillor Knox. I absolutely agree that I think data sharing here is going to be key, and that's almost a given. But I think if we can use the networks of agencies, the voluntary sector, and utilise those trusted networks that we've got in the communities at patient level, I think we've got an opportunity to gain really honest feedback about what works well, what could be improved, what we can learn from each other, and from the experiences of those who have been through the system. I'm conscious we don't need to go into solution mode, but at the same time, I think it's important that we really recognise the voice of the community, and we do have between us vast networks out there where we can really capitalise on what really matters to our communities. Sometimes it's helpful to have the experiences of those who have been through the systems, so that they can talk directly to others who would benefit from the vast array of services that we can collaboratively offer. I think looking at it from a board level as well, that gives us an opportunity to demonstrate how we're collaborating and how we are providing that value as a group together. So I think there's some real opportunities by working very, very closely with those at the front.
I think absolutely right, Mark. And there are different ways of doing it in different areas, as we all know. Some could be based at a fire station, some could be based in a village hall. Getting down to the real nitty gritty of where these discussions could have. But thank you. I think you're absolutely right. I don't have any more hands up on this subject, but there's quite a lot going on in the chat bar, and if Sam is still here, Sam, we are going to go on to that forward plan, but do you want to just say what you've put? Is he still here? Not sure if he is. No, he's gone. Sam's put in a really good piece in the chat bar, sort of building on what a very brief conversation John Selgren and I were having before we started our meeting, which is about the place piece of work. We don't. The new ICS safe and legal date has changed, but actually there will be an item on the agenda on the 30th of March in any case, and it sounds like this and the place piece are all coming or could come together there. So perhaps John and Vivian and Sam have a think about how that might work for the 30th. Yeah, nods. Yeah.
I'll speak if I may, Chair, if I come in.
Yeah.
I put my hand up. Very pleased to. So yes, as Chair of the Place-Based Partnerships Group, I was saying to you just before we came on to the formal part of the meeting that we had the most recent meeting with the group this week. It is taking good shape, as I said to you and I said to them. The extra 2 months is kind of helpful, actually. So we're not letting up the pace of the work that we're doing, but it'll give us the opportunity to really work through some of that detail, make sure we've got good governance and sound delivery. So again, really grateful to you, Chairman, for giving Sam and Vivian, potentially and one or two others who've been involved and who are part of this board, the opportunity on the 30th to have a substantive discussion about this, because I think it's really important now that we begin to bring this work together, because it's an exciting opportunity. But as I said on that workshop in December, that challenge is in our hands to ensure that we've provided effective leadership so that the vision becomes reality for Dorset.
And Claire, I think it's all directors, actually. It's everybody that's involved with this, and that's the whole point, isn't it, of everyone working together.
Claire was there on Monday, Chair, if I may.
So we will all be feeding into that item, won't we? I'm not seeing any more hands up unless I've missed some, but is there anyone who has got any reflections? I appreciate that I think Councillor Peter Wharf is here as the Cabinet portfolio holder for the paper. Maybe not. Oh, there he is. Yeah, Peter, do you want to say anything?
I don't want to add anything because I agree with most of what has been said. I was talking to Leslie and Vivian about this meeting this morning, and I'm keen that Leslie and Vivian and I have a strategy session to try and work out how we can best contribute to the Better Care Fund organisation, because I think there's still some room for improvement in the way we work with Better Care Fund and with yourselves, and that's going to take place in a few weeks' time. And when we've done that, we will get back to you. But thank you very much.
Okay, brilliant. Thank you. So we'll move to, unless Sarah and Kate want to add anything, having heard quite a bigger discussion, which is good. It's always good. So
yeah, no,
anything to add?
Only to thank you for letting us listen into the discussion. It's really interesting to hear the bigger discussion, and we're really keen to get that wider sort of planning and strategic kind of planning work together. So yeah, it's great. Thank you very much.
I'm sorry, we did stray a bit, but that's what happens.
Yes, it's all good. It's all interesting. It's good. Thank you.
No, it could go on and on, I'm sure, because everyone's got something to say on this. It's such an important subject, isn't it? And it touches everybody. What we do need, though, is that further understanding within communities, because one goes into a community, and we know as councillors, we're out there, and I'm sure many do operationally, but we don't often talk about actually the really important matters about actually prevention in communities. It usually ends up about why isn't my bin collected, rather than really understanding some of this really other important work of all of us here today. Right, okay, so we've got the recommendations. I'm going to take them on block, if that's all right, and how we'll do this to ensure it is carried and can be delegated in the most appropriate way is to refer everyone to the recommendation of the report on the Better Care Fund. It was agenda item 5, and unless I see a hand or read something in the text chat bar in the next few seconds or so, then I'll take it that we accept, and as many nods to record would be really helpful, or yeses. Does everyone approve the recommendation who has that vote on the board? I do.
Yes.
Yes.
Brilliant. No objections, and some good yeses. Right. Okay. So, Vivian, you are the director.
Yep.
I think there are some words you have to say.
Yes, so thank you, Chair. So having heard the debate and listened in full, we are pleased to say that the board is recommending under our delegated powers on behalf of the Health and Wellbeing Board that the recommendations in full have been agreed.
Thank you very much indeed, and thank you very much, everybody. Tim and Sam did have to leave the meeting for an important COVID update, so we record their apologies for that vote. But I think, Fiona, you have enough of the board members here to take that forward, I'm sure.
Thank you, Chairman. Yes, I do.
Thank you, Fiona. The next item on the agenda is the forward plan. And I'd like you, if possible, for members just to bear with me whilst I invite Paul to assist me with this item. So the forward plan, is that, don't know if members have got that in front of them. But what I am going to do, you'll see on the forward plan, and we've just actually discussed this item, that on the 30th of March, we will make that item on safe and legal one on place. It might already have been recorded in there. Just trying to get that up. But what I'd also like to do, and don't worry about writing anything down about this, but Paul, would you mind sharing the Dorset Health and Wellbeing Board strategy. So we all agreed a Dorset health and wellbeing strategy. Now, these strategies often don't get referred to, but Paul and I did refer to it when we were discussing what our strategy, how it's being actioned and what needs to be done in light of, obviously, we're moving to a different way of working. Well, part of our work for the Health and Wellbeing Board will be through the changes with the ICS work. So we looked at the Health and Wellbeing Board strategy, and we were going to bring an item, and we'll still do, about what the action plan is. But of course, the action plan depends on all of us as board members and what we might have actioned or could still action. So after this meeting, I am going to email board members to ask them to have a look through the health and wellbeing strategy, and I'll attach it, and see what there is in part of this strategy that they might have said, right, as part of our work, either together or with others, actually fulfills some of the action that has been highlighted in the 3 elements that are in this strategy and the bullet points. Paul, do you want to, for instance, that I think that's the first one, isn't it? Paul, do you want to? Yeah. Are you there?
Yeah. Sorry, can you hear me okay?
Yeah, brilliant.
Yeah. So to remind colleagues, there's 3 themes or 3 priorities in the health and wellbeing strategy. This first one, entitled Empowering Communities, but really has a focus around health inequalities. The second priority, we agreed to focus in on physical activity as a key strand of promoting healthy lives. And I think on both of these first 2 priorities, the intention was we'd write out to you and look for a bit of a stock take as to what actions have been going on to date on each of these 2 priorities. And then the third priority area is around a sort of critical friend governance type role, support and challenge to ourselves and other parts of the system. And there's 4 sort of bullet points here. I think in conversation, Rebecca, we were saying the first 2 we would probably look to Teresa and colleagues to feedback on.
Yeah.
They're very much children focused. The third and fourth, we'll look to have a conversation with Health Watch to see whether they could help with gathering some information to get feedback really on how well join up of systems and services is working for members of the public.
Thanks, and yes, absolutely, and it did disappear. Going through this strategy, that a lot of this is really relevant going forward as well. So to take that stock take would be really helpful, so that we know where we are. I'm not expecting reams and back, but I remember I asked members of the board, it was about a year ago now, just to put some bullet points of what everyone was doing in the field of prevention, and got some really good feedback from that. I'm just asking really for the same type of exercise to take place with this. So number 2, which was about priority, promoting healthy lives. Yeah, that'll be a lot of what Active Dorset and Rupert in public health are doing, but there might well be some others involved in responding to that one. And empowering communities, that stock take should sort of involve probably a lot of the work of the local authority, but also of the CCG and primary care networks as well. But I'll leave it there, because we can't get into that now, but I will ask for some feedback, because we want to make a plan, but we want to make a build on a plan, although it runs until 2023. Where are we? What needs to be taken forward? What are our achievements? And therefore, how do we build on our next year? So we don't come to the end of 2023 and start again. Just want to be able to have it as a rolling programme, but also really inform that discussion about place and the ICS work and build on what we've just been saying. Is there anything else, Paul, that I should say? No. Right. Okay. Thank you very much. Is there anything on that forward plan that anyone else wants to comment on for now? As a hand, Leslie. Is it Leslie's hand?
It's me, Rebecca. Patricia.
It's Patricia's hand. Hi there.
Because the health and wellbeing strategy runs, is it over 3 years?
Yeah.
We, in the next 12 months, we've really got to think about writing the integrated care strategy. And Sam and I are meeting at a point in February just to talk about whether it's possible for us, rather than having a health and wellbeing strategy and an integrated care strategy, that we can just have one that's written in sufficient level of detail so that each part of the system knows its role in the delivery. So I just wanted to make you aware of that, because what Sam or I will plan to do after that is just come forward to the board with a proposal to discuss with everyone, see if everyone's happy with it. I just don't want to take everyone's time up for months writing 2 different strategies, because I just don't think it's very helpful to anyone.
I mean, yes, and it's also sometimes people just write a strategy and then don't follow it.
Yeah,
so
exactly.
I think it'd be much better to have a strategy that everyone actually understood and was holding in their hand all the time.
Lovely.
But what I would just say is the integrated care strategy might not cover everything that the Health and Wellbeing Board might be doing. So it's sort of ICS plus, is it?
Yeah, and we're conscious of that, and so we'd probably need to just submit part of it to NHS England, but yeah, we're conscious of that.
There's a lot of what will be driven through the Dorset Health and Wellbeing Board. It might be a little different from our colleagues in the BCP area because of the geography that we deal with, and we've got a very different level of local government in Dorset compared to the other area. Peter Wharf, you had your hand up.
I did, Chairman. Can I just, this follows on from a conversation I had with Patricia when I rang her up to congratulate her on her appointment. I entirely agree with the idea of a single overarching strategy, but I think we need to be braver than that. We need to think about what other areas we need to pull together, because there's no point in having a single strategy, but multiple means of delivery that are actually crossing over each other. I'm not saying they are, but I am saying we need to use this as an opportunity to rethink how we organise more things than just the strategy. Thank you, Chair.
Thanks, Peter. Okay. Right. I think we are, if everyone's happy and I don't see any more hands. I haven't got any urgent items. So I haven't got any exempt business at the moment. So thanks everybody, and we will meet again on the 30th of March, but in the meantime, as I said, I'll just be emailing you to get your feedback on the strategy as it is. And that might actually help, Patricia, inform the work that you are doing with looking at sharing a Health and Wellbeing Board strategy and an integrated care partnership strategy.
Yeah, it will, I think, Rebecca. Yeah.
Yeah, great. Okay. Thanks, everybody. I haven't heard from everybody today, but I know you're all there, and great meeting. Thank you. Hope everyone's found it helpful, and see you soon. Okay. Bye.
Thanks, Rebecca. Cheers.
Thank you, Rebecca. Thanks all. Bye.
Bye.
Thank you, Chair.